Hello, my name is Alice Moores and I'm a Clinical Education Leader in Programme Quality for the statewide Occupational Therapy Clinical Education Programme in Queensland Health. This presentation is third in a series on clinical decision making. It discusses some of the common challenges inherent in sharing clinical decision making with others and what experienced health professionals may need to consider when doing this. The clinical decision-making of experienced health professionals has been characterised as being complex. It's often tacit and less conscious compared with the clinical decision-making of novice health professionals. This means that learners, either students or novice health professionals, find it difficult to understand the clinical decision-making of more experienced health professionals by observation alone. Equally, experienced health professionals often find it difficult to communicate their clinical decision-making to others in a way which makes it explicit. This is because their clinical decision-making is often automatic or less conscious. Let's consider for a few moments the characteristics of the clinical decision-making of experienced or expert health professionals. Experienced health professionals are intuitive. Their clinical reasoning is not rule-based and linear. They're flexible in their use of formal and tacit or understood and implied knowledge. They're fast, effective and creative in their interventions. When experienced health professionals make clinical decisions, they commonly chunk information into recognisable patterns. They draw from an extensive bank of reasoning and decision-making patterns or illness scripts and case examples. They isolate relevant from irrelevant material. They formulate tentative hypotheses about patient care, and they do this early. And they access more unconscious cues from their environment. It's important that experienced health professionals share their clinical decision making so that novice or less experienced health professionals can learn from it. Experienced health professionals need to develop a language to enable their clinical reasoning to be explicit and visible, revealed and understood. In order to do this, they need to first develop their consciousness and awareness of their clinical reasoning and clinical decision making so that they can then describe it to others. So let's have a think about what can be done. Reflecting on practice and developing metacognition supports the development of consciousness about practice decisions. Metacognition is the development of awareness of one's own cognitive processes and cognitive skills necessary to manage knowledge. It is essential for learning from practice as it involves practitioners being able to critique their own decision making. It allows health professionals to monitor their clinical decision making in practice, including identifying the impact of their knowledge and when this knowledge is insufficient. When developing metacognition or consciousness about one's own reasoning, it's important to consider what we need to develop consciousness about. Developing consciousness about the knowledge base informing clinical decision making is important. Health professionals draw on different types of knowledge in various ways to inform their clinical decision making in practice. The knowledge that they draw on can be propositional. Propositional knowledge is derived from theory and research. It's commonly referred to as knowing that. Knowledge can also be non-propositional. Non-propositional knowledge is derived from professional and personal experience. It's commonly referred to as knowing how. Knowledge supporting clinical decision making can originate from evidence or research-based knowledge. It can also be derived from practice-based knowledge. Health professionals often combine both evidence-based and practice-based knowledge together when making clinical decisions in practice. Health professionals also use discipline-specific knowledge, that which is derived from within their profession. They combine this discipline-specific knowledge with related knowledge. Related knowledge is derived from outside of their profession, but it's accessible and it informs what they do. Developing an awareness of the knowledge base which health professionals draw on to support their clinical decision making is a useful first step prior to sharing it with others. The next presentation in this series discusses how health professionals can support the clinical decision making of novice learners in their role as either clinical educator or as a supervisor. The presentation also guides listeners to 5 strategies to support the clinical decision making of students or novice learners, including sharing clinical decision making. To consider the information in this presentation further in relation to your own practice, we invite you to reflect on the following questions. Think of a time when you needed to describe your clinical reasoning to a student or a less experienced colleague. What were the challenges? In what ways do you reflect on your own practice? Do you think through a process to guide your reflection on practice? Do you use tools or particular strategies? What knowledge informs your clinical decision making? How would you describe your clinical reasoning to a colleague of the same or a different profession, or a new graduate or student? Thank you for your reflections and for listening to this presentation today.